Welcome to the Maryland Legislative Agenda for Women's 225 Legislative Briefing. My name is Michael Cohen, and I am MLAW's president. MLAW was created 30 years ago to harness the collective power of women to advocate for legislation that improves the lives of women and their families in Maryland. Today, as we face extraordinary changes and challenges at the federal level, actions at the state level are more important than ever to protect our citizens and ensure the safety and security of women and families. You can make a difference by taking action and contacting your legislators about the bills on this year's agenda. MLAW is a statewide nonpartisan coalition of individuals and organizations that produces and distributes an annual legislative document to all legislators and advocates throughout the state. We have supported legislation to address domestic violence, sexual assault, economic justice, human rights, healthcare, family law, and criminal justice. These continue to be critical areas of concern. For the past 30 years, we have made our collective voice heard on the successful passage of 119 pieces of legislation. MLAW is also an ally in the fight against systemic racism, racial justice, injustice, and discrimination. We continue to support diversity and equity by strongly advocating for legislative priorities that address issues of concern to women that also disproportionately affect communities of color. Our support in this effort will not waver. MLAW's democratic process for creating the annual legislative agenda begins, MLAW's democratic process for creating the annual legislative agenda begins when bills are presented at an annual fall conference by lead advocacy groups and legislators. Paid MLAW members then vote to select the priority bills that are included on the agenda. We ask individuals and organizations to sign on to the agenda to affirm their support and demonstrate our collective power. For the 2025 agenda, following the in-person Fall Legislative Conference in November 2024, we sent a ballot with the bill proposals that were presented at the conference to the paid MLAW members, who then ranked their choices. The voting results were reviewed and the agenda was finalized by the Board of Directors in January. 10 issues were selected for this year's agenda. During the legislative session, we introduce and disseminate the agenda document. We collaborate with lead groups and legislators. We write letters of support, provide testimony, and provide information, updates, and legislative alerts via email, our website, and Facebook page. After the session, we communicate legislative outcomes with a final report and a legislative wrap-up. We invite you to get involved, to join and become a voting member of MLAW, to learn about the important legislation in the MLAW legislative agenda, and to make your voices heard by contacting your legislators about legislation that will make a critical difference to women and families in Maryland. MLAW would not exist without our wonderful board of directors, a diverse group of women from all over Maryland who dedicate their time and talents to MLAW. I want to also thank our wonderful sponsors seen on screen at the end of the event. I also want to thank everyone that signed on in support of the agenda. This is a powerful demonstration of our widespread representation and collective power. And just a reminder that you can download the agenda for this event, as well as the entire agenda document. A link for the documents was sent to you in advance with the briefing link, and we will also put the link in the chat. The agenda is also on the MLAW website. Now we want to recognize the legislators who are attending the briefing. Please put your names and titles in the chat. Legislators, also please use the raise hand function in Zoom to announce that you're here so that we can easily identify and unmute you. Our Vice President, Angela McDaniel, will ask each of you to put yourselves on screen and identify yourselves with your title, delegate or senator, county, and district. We'll unmute you when your name is called. We'll also recognize additional legislators at the end of the briefing.
Good evening, everyone. I'm proud to be the Vice President of MLAW and be with you here today. So as people are still coming into the chat room, thank you for joining us. Please, as Michael mentioned, put your information in the chat and I will acknowledge you so you can speak on the county and who you're representing. And don't worry, I know that some people will be coming into this chat room kind of late. There'll be plenty of time at the end for people to acknowledge themselves as delegates. And if your representative, if the representative of the delegate is also here, please let the delegates know that as they join, they should put themselves in the chat. That's great. So Gretchen, thank you. Chief of Staff for Senator Sarah Love. Senator Love is still in JPR hearing, but if time permits and we're still online, she will join us. So it's great. So please let us know, Gretchen, in the chat if you when she's on.
Okay, well, we can wait and introduce people as they come in, and Kate Campbell Stevenson will introduce them at the end. Thanks, Angela.
Okay. Thank you. No problem. Excited to hear about all the wonderful bills that are going to make an impact on the citizens of Maryland. Thank you.
Okay, we're now going to introduce the 2025 MLAW legislative agenda bills. Our secretary, Sheena Foster, will introduce each bill and presenter. You will have an opportunity to ask questions after each presentation. Please use the chat button at the bottom of your screen to write your question. Please note that it is a question by marking it with a Q and who it is it's directed to. It would be helpful if attendees would limit their comments during the bill presentation section so that we can more easily identify the questions. Now I'm going to turn the briefing over to Sheena Foster to introduce the first presenter.
Hello, everyone. We're so excited to have you here today. We have a slate of 10 bills, and I am just so delighted to introduce each and every one of them. So our first bill is HB 629, SB 549, Civil Actions, Immunity, Disclosure of Allegations of Sexually Assaultive Behavior, the Stop Silencing Survivors Act. And that's going to be presented by Lisa Lasay Jordan from Maryland Coalition Against Sexual Assault. Lisa, you have 3 minutes.
Thank you so much, Sheena, and thank you everybody for being here. This is one of the most powerful grassroots groups in Maryland. You guys really, you make such a difference with your phone calls and your emails and your texts and your advocacy. So thank you so much for everything that you do. The Stop Silencing Survivors Act it's sponsored by the amazing Sarah Love, and who's a senator now from District 16, and then also from Sandy Bartlett, who is the vice chair of the infamous Judiciary Committee. And so this is a bill about retaliatory lawsuits. So I'm gonna tell you a story because I think it's the easiest way, the best way for us to understand what's going on. We had a client at the Maryland Coalition Against Sexual Assault at our Sexual Assault Legal Institute, and she was sexually assaulted by her doctor. And like many women who were sexually assaulted, she decided not to report it. She said, okay, I don't want to deal with it. But then one night she woke up in the middle of the night and she saw on TV a prosecutor, and the prosecutor was saying, if you have been sexually assaulted by this man, please come forward. Please report to the prosecutor's office. So she did. And she and 3 other survivors of sexual assault by this doctor all had their cases investigated and charges were filed against the doctor. The cases were prosecuted, but the first one came back not guilty. These were poor women in Prince George's County. The doctor was, a polished physician. And so they weren't able to overcome reasonable doubt. So the prosecutor said, we are going to stet these cases, but in return, doctor, you are going to permanently and forever give up your license to practice medicine. And so he did. And then years later, he turned around and he sued her. He sued her for intentional infliction of emotional distress. He sued her for defamation. He sued her for interference with contract. It was a huge stack of papers. And he tried to get money from her in response to her speaking out about the sexual violence that he had inflicted on her. Now, the end of our client's story is that case was dismissed and she has no judgment against her. But what I want you to know is that this is a trend nationally. We are seeing it all over the state. We see it all over the country, where people speak out about their sexual assault, and then the perpetrator turns around and sues them. There are actually law firms. There's kind of a cottage industry of law firms where they go out and they look for people who have been accused of sexual assault, and they say, hey, we'll help you. We'll sue the survivor. And so what Senator Love and Delegate Bartlett's bill does is it does not shut down access to the court. What it does is it says, you know what? If you want to sue someone who has accused you of sexual assault, you need to prove that it was either false, it had a reckless disregard of the truth, or it was made with actual malice. And so this kind of, it levels the playing field a little bit. And it's important to MLAW, and it's on the agenda, I think, because we know that most sexual assaults, not all, but many sexual assaults are against women. And sexual assault continues to be the most underreported crime anywhere. People don't want to come forward. And so we don't want our court system to make things worse and say, if you do come forward, you're going to face a long, traumatizing, expensive lawsuit. We want to say, no, in those cases, the alleged perpetrator has to prove a little bit more before they can use the courts to silence you. It's a very strong bill. It is being heard tomorrow in the Senate. That's Senate Bill 549. It's being heard next Wednesday, House Bill 629 in the Judiciary Committee. I saw the question about the budget. This is not a bill where we're expecting there to be costs. However, I will say in that vein, the governor's budget proposes cutting $10 million for crime victim services and raiding the rape kit testing fund by $4 million. So I think those cuts could potentially affect this. And that is also something that, you know, is related and that we all care about as activists in this field. So I believe that is my 3 minutes. And I thank you very much, Sheena, for your attention. And I'm happy to answer questions.
Thank you so much. I'm actually looking right now in the chat. Okay, question for you, Lissay. If the courts determine the case was inconclusive, does that allow an accuser to file suit?
So I'm going to interpret that as saying if a criminal court thought that the case was inconclusive, and that criminal determination does not prevent the civil suit. So no, that would still be something that would go forward.
Okay, thank you so much for your time, and thank you so much for answering our questions.
Thank you.
Our next bill is HB 1050 SB 943, Family and Law Enforcement Protection Act, presented by Karen Herron of the Marylanders to Prevent Gun Violence. Karen, you have 3 minutes.
Thank you. So yes, I'm Karen Herron. I'm with Marylanders to Prevent Gun Violence. I'm here on the Family and Law Enforcement Protection Act, SB 943, HB 1050. Each year, approximately 47 individuals in Maryland lose their lives to a domestic violence situation with a gun. In 2023, at least 32 children in the state were left without one or both parents because of domestic violence. Currently, we have gaps in our state laws, where individuals are seeking domestic violence protective orders, and the respondent is then required to turn over firearms. Maryland's gaps come into play where we don't have adequate processes around that firearm relinquishment piece, and that is what this legislation is designed to address. This has been a wide coalition of gun violence prevention advocates, domestic violence advocates, working with the legislators, and pulling in conversations with chiefs and sheriffs, Maryland judiciary, Maryland State Police to better understand who has access to the gun records. Basically talking to all the right people to try to figure out what is going on and how we can fix it. The bills both in the House and the Senate just dropped this week. We got bill numbers back really quickly and hearing dates. So hearing in the Senate is scheduled for February 19th in JPR. And in the House, we have a date of February 20th. I will say that this, as all bills do, things and languages tends to adjust over time. And someone mentioned the fiscal note, so I'm going to go ahead and address that now. What this bill will do is it will pull the mandate to order a respondent to turn over firearms into an earlier stage in the proceeding, with a lot of instruction and a lot of verbal and written instruction to the respondent as to what that is and what that means, in the hopes that, not just hopes, but in the the plan being that the earlier and quicker and clearer we make this situation to respondents, the easier it is for them to comply and the less likely it is that we need to circle back on the back end and fix it. We need a compliance piece on the back end, but, and it's always a big but, the fiscal note situation in the state of Maryland is pretty dire at the moment, and any bills that have any significant fiscal note, as you all know, probably won't make it. So what we've done is we've already started a lot of these conversations about how to make this more effective. But it's most likely turning into what will be sort of a work group with a plan to roll out some pilot projects around the state in different types of jurisdictions to really get buy-in from the organizations and the entities that actually carry this stuff out, and make sure we're creating something that not only we think works, but that actually works. And so because of that, we are not expecting the bill to have a big fiscal note at all, or really any. So anyway, so that's where things are now. I probably summarized that faster than my 3 minutes. If that question is to me, the bill numbers, that our bill numbers are 943 or that Senate Bill 943 and House Bill 1050. I don't know, maybe that was for that last speaker, but certainly happy to answer any questions. It's been a really fast-paced week, I'd have to say. I don't think I've ever had a bill filed with hearing and got hearing dates back quite so quickly as this bill has been. So I think maybe that's a good sign.
Are there any questions for Karen? Someone said, how many pilots?
So I don't think that's set in stone, but the general thought and concept, and I can't remember if this is actually in the language or in the discussions, would be to pull in different types of jurisdictions. So a city, suburban, and rural district to run the pilots, so that, because we know that the situations might look different depending upon what you're talking about, but probably 3.
Okay. Thank you so much, Karen, for your time. Oh, there is one other question. And I'm only going to take this one other question before we move to the next bill. Is a compliance piece for handguns in another bill that would address this? Is there a compliance piece for handguns in another bill that would address this?
Look, it's not like we're not doing, theoretically the job of the sheriffs is to go get the guns, right? Like, so, they've got the authority to do the compliance piece. It's just a matter of whether it's always happening and whether there's a check on things. While we are making some adjustments to when the firearm relinquishments are required in the domestic violence protective order process by sort of making it earlier for a number of reasons, at the end of the day, Maryland is already requiring that domestic violence perpetrators are relinquishing their firearms. And so this is just closing the gaps that are existing, if that makes sense, to try to make this work effectively.
Thank you so much, Karen, for your time and for answering our
Yeah,
question.
thank you.
All righty. So the next bill is House Bill 930, Senate Bill 848, Public Health Abortion Grant Program Establishment, presented by Robin Elliott from Public Policy Partners. Robin, you have 3 minutes.
Yeah, good evening, everyone. So very excited to end the workday on such a positive note with wonderful allies in this space. So I'm just gonna start. I'm gonna put in the chat language from our constitutional amendment, which thanks to the hard work of many people here, passed in Maryland, and now we have reproductive freedom protected at the highest level. So one of the really key parts of this language is that we have protected the right to reproductive freedom in Maryland. But this also says that we are supporting the right to effectuate one's decisions. So in reproductive health space, this could change in our landscape, but traditionally many parts of the reproductive health spectrum have been supported by public funds, family planning, prenatal care. The one area where there is no public funding is in abortion care. And that is because of the legacy of the federal Hyde Amendment, which many of you are familiar with. So what can we do about it, especially in a year in which we have a tight budget? Well, luckily, there is a fund, there's unspent money that insurance carriers have that they have not spent on abortion care. So they are required to collect a certain amount to provide abortion coverage. And if they don't spend it, the funds just sit there. That is a little quirk of federal law. So what the bill does is it moves those funds over to the Department of Health. There are about $25 million sitting in those funds right now, and about $3 million a year in addition. And it moves those funds over and creates a public health grant program that will provide support for abortion providers and abortion funds across our state. We're very excited. The bill is sponsored by Delegate Leslie Lopez and Senator Guy Gazzoni. We don't have hearing dates yet, but I know MLAW does a great job at keeping everyone posted, and happy to answer any questions.
Yeah, thank you so much. I'm actually looking and it says, does this apply to insurance companies in all states?
So in Maryland, we can pass laws that affect insurance companies in Maryland. What's really exciting is that we would be the first state in the country to do this. And so there are a lot of eyes on us. And so it could really open the door to other states, New York, New Jersey, Delaware, California, Illinois, Maine. I'm thinking of many of the states that are supportive of reproductive health access. So we're really trailblazing here, and we could essentially effectuate reproductive freedom for millions of people through this kind of measure.
Okay. It looks like someone maybe, I think they may have written it under something else, but it looks like what they're asking is, do you need any volunteer testimony for this?
Yes. So the answer is yes. And I'm going to put my email in the chat, and I know Delegate Lopez and her team are being very active in organizing testimony. I saw the comments. We do have great sponsors, and also have a history of great sponsors extending to last year. So I'll put my email in the chat. I'm very happy to help facilitate connecting you to Delegate Lopez.
Thank you so much, Robin. Thank you. All righty. So our next bill does not have a House bill number yet, but it's Senate Bill 632, Correctional Services, Comprehensive Rehabilitative Pre-Release Female Incarcerated Individuals, the Monica Cooper Pre-Release Act, presented by Monica Cooper from Women's Pre-Release Equity Coalition. Monica, you have 3 minutes.
Okay, well, thank you very much. The first thing I want to say is thank you to this body for always welcoming me and making me feel like I'm in a safe space. From the very first time I presented this bill, the prior bill, I've always felt safe. And that's not always the case for, for this work and for myself. So I just wanted to say thank you to this body for always being welcoming. My name is Monica Cooper, and I'm the executive director of the Maryland Justice Project and the founder of the Women's Pre-Release Equity Coalition. I am here in support of the Monica Cooper Pre-Release Act, which mandates equitable pre-release facilities and services for women in Maryland. Some longtime MLAW members may be thinking, didn't we already support legislation to require the Department of Public Safety and Correctional Services to build and operate a women's pre-release center? Yes, you did. And the coalition remains grateful for that support that we received in 2021. Over Governor Hogan's veto, the General Assembly passed the Gender Responsive Pre-Release Act, which required DPSCS to build and operate a women's pre-release center in Baltimore City and to provide gender-responsive, trauma-informed, and evidence-based pre-release services for women. The statute required the Women's Pre-Release Center to be operational by the end of 2023. It's now 2025. I'm here today because since that time, DPSCS has done the following: selected a site that is less than half the minimum size that former DPSCS Secretary Green requested the Department of General Services to obtain, and is located among the prison and detention center in Baltimore City, which is drug infested and unsafe for the women and for family visitation. Also, the department has planned a facility that is too small to accommodate the number of women in pre-release status today, and that number is expected to grow. The other thing that they did was the department will require women to get their pre-release programming at the yet-to-be-built maximum security Baltimore Therapeutic and Treatment Center, which will be 90% male and focused on treatment for individuals entering criminal system because of mental health or substance abuse issues. DPSCS has refused to fund the facility and does not intend to even begin construction until fiscal year 2028 and will not complete construction until fiscal year 2030. To remedy these deficiencies, Senator Mary Washington and Delegate Charlotte Crutchfield have sponsored the Monica Cooper Pre-Release Act, which require DPSCS to find a new site for the women's facility, for the women's pre-release center that is at least 3 acres in size, and to build a facility that is large enough to house at least 91 women. The act requires the women's pre-release center to be operational by June 2027, and it clearly defines what gender-responsive services DPSCS must provide. The bill also requires those services to be provided at MCIW no later than July 2026. But once the pre-release center is operational, those services must be provided at the Women's Pre-Release Center, and women cannot be made to obtain those services at any other facility. The Women's Pre-Release Equity Coalition has been working since 2018 to get the state of Maryland and DPSCS to correct a glaring inequality in the treatment of Maryland's incarcerated women. The coalition is grateful for MLAW's support, and we hope that with the passage of the Monica Coopers Act by 2027, incarcerated women will get the facility and services they need to transition home. Thank you.
Thank you.
Oh my goodness, that went well. Thank God I had a piece of paper. Good Lord.
Yeah, thank you
God.
so much. Thank you so
Woo.
much. So I am looking in the chat, Monica, and it doesn't look like we have any questions for you. Does anyone, I'm gonna give you one last opportunity to ask any questions of Monica. If they don't have any questions, that means you've just done a really good job of explaining your bill.
Oh, amen. Because I was anxious and I was trying to read and
Okay,
and oh my God, and thank you so much, guys. I'm glad that I got through it, and I hope everybody, understand the importance of what we are doing. So thank you, and again, from the bottom of my heart, thank you for always welcoming me.
thank you so much, Monica.
Appreciate
Someone did ask a question about the bill numbers. And this bill number is Senate Bill 632. There isn't a House bill number yet. And it is also in the packet. So please click on the link that is in the chat so that you can review the legislative packet. And also please listen carefully as I call out the bill numbers at the introduction of each bill. So thank you so much, Monica. Our next bill will be House Bill 424, Senate Bill 357, Prescription Drug Affordability Board, Authority for Upper Payment Limits, Lowering Prescription Drug Costs for All Marylanders Now Act, presented by Catherine Kirk Robbins from the Maryland Health Care for All. Catherine, you have 3 minutes.
Great, thank you. And the childcare stars did not align, so if you hear a lot of toddler background noise, I apologize. So thank you for the opportunity to give you some information about this bill, and thank you for MLAW's support. In 2019, Maryland passed the nation's first Prescription Drug Affordability Board, which is an independent watchdog-like agency that looks at high-cost drugs and determines fair, affordable rates for folks to pay. In 2019, again, thanks to MLAW's support, we were successful in passing that law, but not as we fully envisioned. So instead, the board was tasked with sort of a pilot phase where they would address drug costs for state and local governments, and with the intention of coming back in 2023 to expand that authority statewide. And thanks to the COVID pandemic and sort of government slowdowns, as well as the Hogan administration slow walking funding and appointments to the board, we got off to a relatively slow start. But in the past year, we've just seen incredible progress in determining regulations, selecting drugs for review, and passing an upper payment limit action plan for state and local governments. So we are back in front of the legislature this year with really excellent sponsors. We have Senator Don Guile in the Senate and Vice Chair Bonnie Cullison in the House. And we are looking to expand to statewide upper payment limits. So essentially what this does is it looks at high cost drugs, determines a fair rate based on a huge number of economic factors, and sets that rate for the entirety of the state. And this is very similar to sort of rate setting in healthcare systems currently. This is just really saying prescription drugs are a public good. You can no longer charge, whatever you feel the market can deem will bear. This is the rate that Marylanders will pay. And, we've seen really egregious practices across this industry in past years. I don't know if any of you have noticed a pharmaceutical advertisement in the past, day or year, or they're constant. But we're really saying, you need to, if you're in the business of saving lives, we need to make sure that people have access to these drugs, because drugs don't work if people can't afford them. That bill, and I'll talk about a second bill after this, has a hearing tomorrow. We anticipate it will move quickly in the House, and it'll be a much bigger fight in the Senate. So we are asking folks to sort of focus their efforts in contacting their senators. And I will put a link in the chat for that is an action form for folks to contact their senators. And yes, and it will apply across public insurance, private insurance. If you're uninsured, the upper payment limit will impact, what you pay as well. It's a broad reaching, it basically makes the entirety of the state a purchasing pool, and that rate will be across all sectors.
Thank you so much. Thank you so much, Catherine. It looks like you jumped ahead of me and answered questions from the chat. Okay. Let's see. There is one other question. And the question is, what might the objections be to this bill?
Oh, well, there's a lot. So the pharmaceutical industry, manufacturers in particular, claim that they need this money for innovation, for research and development. And what we know is that the major driver of price increases are actually on existing drugs. For example, there's a breast cancer drug called, what is it called? Well, now I've forgotten. Someone with an H. That has been around since the 80s, and these manufacturing companies have abused the patent system to maintain patent exclusivity. So it's still $60,000. So there's annual price increases. We see that with Ozempic. We see that with Paxlovid. All of these sort of public health focused drugs are having their prices increase, not because of innovation, just because there's a government sanctioned monopoly for brand name drugs. We also know that taxpayer dollars heavily fund research and development already. So every single drug that came to market between 2010 and 2019 had origins in publicly funded research. And we know that the 10 manufacturers of the first 10 drugs selected for Medicare negotiation spent $22 billion more in 2022 on advertising, stock buybacks, and executive pay than they did on research and development. So that's sort of an empty threat. I think that's the biggest argument. The other one that I'll touch on very briefly is that, will this actually help consumers, or will the savings be sort of eaten up in the black box of the drug pricing supply chain? And our answer is, we're very confident that this is the most effective way to get those cost savings to consumers. It really makes the process more transparent. And it also, we have some added protections with our consumer protection law and medical loss ratio, insurance reviews, et cetera, that I'm happy to offline get into if people are interested in learning those details.
All right. Thank you so much, Catherine. Since you are presenting and speaking on the next bill as well, I'll go ahead and introduce that. Our next bill is House Bill 334, Senate Bill 150. I'm so sorry. I jumped ahead. House Bill 297, Senate Bill 5.
That's it.
Maryland Health Benefit Exchange, state-based young adult health insurance subsidies pilot program, the sunset repeal, and it's also being presented by Catherine. 3 minutes.
So this one is essentially just removing a sunset on an existing program that is used to get young people into our state health benefit exchange. this costs $0 to taxpayers, to the state. This comes out of a reinsurance fund, which is an assessment on insurers, that is designed to both sort of serve as insurance for insurers and explore ways that you can strengthen the insurance pool. And so this has been a very effective subsidy program, for folks 18. It was 37. The number of might be a little lower, in this sort of expansion. But it has gotten 29,000 women, give or take, enrolled in the program for the first time. And most have maintained that coverage at very low cost to them. So when young folks are in our insurance pools, premiums can be lower because generally they are healthier, and it's also just a lot better for folks to have insurance coverage that they need. So this is a very successful program. Again, $0 to the state, as is the Prescription Drug Affordability Board, which is independently funded as well. But this would remove the sunset and say that this program exists until 2028, when the reinsurance fund, the reinsurance assessment is set to sunset itself. And at that point, we would reconsider, we would certainly fight for it to be included should that reinsurance assessment be included. There were hearings on the 29th and 30th. There's a little mix up in some of the language. The bills don't match perfectly, so the Senate is the correct version if you are looking into that. And we will have that corrected. It should be a pretty easy lift. We always encourage folks to reach out to their legislators, and I'm happy to provide language. I know MLAW sent out a really good sort of action alert about it earlier, but this one is probably not our biggest advocacy ask.
Thank you so much, Catherine. I don't see any questions in the chat. If you have a question, please put it in the chat. Okay, doesn't look like we have any questions. Thank you so much for your time and your presentation, Catherine. Let's see. I do have one question if you're still here. It says, which org sent out an advocacy alert?
It was MLAW sent out a legislative alert,
Okay.
about the bill and inability to send an email to members. So
Okay. Right. Thank you so much.
Thank
you. Right. So my question is there anyone in the meeting who is presenting for House Bill 344, Senate Bill 156, the Universal Newborn Nurse Home Visiting? Well, we don't have anyone presenting on that, but in your legislative briefing packet, you can find information on page 23. The one sentence synopsis is that this bill provides families with newborns in-home visits to promote child and maternal health, positive parenting, family self-sufficiency, and other aspects conducive to family cohesion early in a newborn's life. And those are bill numbers HB 334, SB 156. Okay. Our next bill is House Bill 647, Senate Bill 702, Correctional Services, Segregated Housing Limitations, presented by Natasha White, Director of Community Engagement for Interfaith Action for Human Rights. Natasha, you have 3 minutes.
Hi, everyone. First, I want to say thank you so much for inviting me to speak on behalf of this legislation. It is extremely important to me as I am a survivor of solitary, and I have dedicated my life to ending this torturous practice. So how does HB 647 and SB 702 protect incarcerated people in Maryland? First of all, our bills are sponsored by Delegate Scott Phillips and Senator Sarah Love. Thank you to them as well. We all know solitary confinement, or so-called restrictive housing, keeps people locked in a cell for up to 23 hours a day, often with no human contact. It's a practice that can cause severe mental and physical harm. This proposed law aims to change that by limiting how and when solitary confinement can be used in Maryland prisons by ending long-term isolation, protecting vulnerable populations, and stopping the direct release of people straight from solitary to the community. No one should be left in isolation for extreme periods of time. Under this bill, no one can be placed in solitary for more than 15 days in a row or 20 days within a 2-month period. Right now, people can be kept in isolation for weeks, months, and even years, which research shows can cause long-term trauma. This bill puts an end to that. Certain groups face even greater harm when placed in solitary. So these bills ensure that the most vulnerable populations cannot be placed in restrictive housing at all. This includes people under the age of 21, people over the age of 55, pregnant women who recently gave birth or those recovering from miscarriage, and people with severe mental illness. The United Nations recognizes that putting people with mental illness in solitary confinement is a form of torture. Yet in 2022, Maryland placed 370 people with serious mental illness in restrictive housing. These bills put an end to that, ensuring people get the mental health care they need instead of being locked away in isolation. Imagine nearly 2 months alone in a small cell with almost no human contact, then being sent straight into the community with no support. In 2022, 135 people were released directly from solitary confinement after spending an average of 59 days in isolation. This kind of transition is dangerous, making it harder for people to adjust and increasing the risk of reoffending. By limiting solitary confinement, these bills help people leave prison more prepared to rebuild their lives. What this means for incarcerated women. For women in Maryland prison, this bill offers critical protection. It ensures that no pregnant woman or mother is subjected to the trauma of solitary confinement, guarantees mental health care instead of isolation, and stops long-term solitary confinement that can lead to lasting harm. More than anything, these bills shift Maryland's prison system away from punishment and toward rehabilitation, giving people a real chance at healing and re-entering into society. Any questions?
Thank you so much. Thank you, Natasha. I saw a question in the chat and it seemed to have moved. Let me see if I can, let's see. Okay, let's see.
Yes, I see it. So yes.
Can you read the question out loud? Because I can't.
Is it true that those punished are usually not violent?
Yeah, you can answer that one, but there was also another question. So please answer that one and I'll look for the other questions that was put in the chat. Thank you.
Okay. A very small percentage of people sent to solitary confinement are for violent reasons. I was in solitary confinement for 4 years, and it was strictly because of who I was married to. Mind you, I was in a woman's facility, and he was in a man's facility. I know people who have gone to solitary for having too many sheets, excess pens, being sick, and not wanting to go to their work detail. They will send you to solitary for that. Solitary is abused and used as a form of control and a way to not be dealt with.
Okay.
Did you find the other question?
No, I did not find it. The person could have removed the question. But thank you so much, Natasha. If you all have any additional questions for Natasha, you can find her contact information in the legislative briefing packet. Thank you.
Okay.
All right. So our next bill is House Bill 933, Senate Bill 679, Nursing Homes, Direct Care Wages and Benefits and Cost Reports, the Nursing Home Care Crisis Transparency Act, being presented by Lorraine Ericat with 1199 SEIU Healthcare Workers East.
Thank you so much. It's really exciting to be able to present this legislation to you all, and I am internally grateful for the support. This legislation, the Nursing Home Care Crisis Transparency Act, will ensure that 75% of nursing home revenue goes towards direct care and the women-led workforce that provides it. This is an important step to improving state oversight of public dollars and improving both job and care quality. Of the nursing home industry's $140 billion in total annual revenue, 66% of payments come from public programs, primarily Medicaid and Medicare. In Maryland, our nursing homes are often going through a churn of nursing home owners and operators, and our members can tell you that with each change in owner, quality of care often diminishes. This bill aims to improve reporting requirements in Maryland because cost reports do not often capture the information to enable CMS to fulfill its regulatory obligation to make sure taxpayer dollars are going towards care and not just profits to owners and operators. Data shows that the population of individuals living in the lowest ranked facilities in Maryland are disproportionately people of color, mostly Black, and that is not an accident. Systemic racism lies at the root of these disparities, manifesting by racially segregated care, low Medicaid reimbursement, and lack of livable wages for staff, all of which exacerbate disparities. 90% of nursing home workers are women. In Maryland, the average hourly wage is $15.43 for nursing assistants in nursing homes. Wages are so low and the demand to work understaffed often burns out workers, pushing them to leave the field. Many direct care staff, including custodial services, dietary aides, CNAs, and GNAs, are working at multiple facilities to earn money. Our members can tell you that nursing homes are gaining more and more high-need residents who are being discharged from our hospitals. But due to short staffing, staff are unable to adequately care for their patients, leaving some residents to be left unattended in substandard conditions. Strengthening oversight of nursing home revenue will have a direct impact on quality of care for our most vulnerable residents who are aging and with disabilities. Nursing homes will have to report that they have met the 75% direct care cost requirement through their cost reports. This legislation mainly holds bad actors accountable to making sure they're investing in care and protecting the health, safety, and rights of residents and staff. Our sponsors this year are Delegate Martinez and Senator Rosapep, and we have bill hearings scheduled in Senate Finance on February 18th and House Health Government Operations Committee on February 20th. And lastly, this year, a version of the legislation focuses on having a very minimal fiscal note and instead focuses on fiscal transparency. And with that, I will take any questions. Thank you.
Thank you so much, Lorraine. I actually have a comment from a visitor. And her comment is, many of the nursing home workers are also immigrants who are reticent to stand up for themselves and will work even when ill. Their benefits leave much to be desired. Yes, they have to work several shifts at several different facilities. Are there any efforts to reach out to the workers for help?
Well, 1199 SEIU is a labor union that represents healthcare workers across long-term care facilities, hospitals, and clinics. So we do represent a lot of workers across different nursing homes in Maryland. And part of our effort is to really make sure that workers know their rights, that their rights are protected, and that we're able to fight for improved quality of care for their patients through bolstering job quality. So we hope that this bill and you know, the work of the union can continue to reach out to more workers across the state.
Okay, it looks like someone who wants to get engaged with you. Fatima, if you want to reach out, you can get Lorraine's information. It is in the legislative briefing packet. Or Lorraine, please feel free to drop your email and contact information so that those who want to support could follow up with you. Okay. Our last and final bill that we're going to be presenting does not have a House bill number, and the Senate bill number is 314, Certificates of Birth Licenses and identification cards, designation, Birth Certificate Modernization Act, presented by M. Peace and Charlotte Persephone Hoffman.
Persephone Hoffman.
Persephone Hoffman,
Thank you. And
and
Em,
Maryland.
thank you.
I'm sorry. Go ahead.
Sorry. I spoke while you were still speaking. So it was my bad. So thank you, everyone. Em unfortunately had to leave just a little bit ago. We had our Senate hearing today, and it went until about half an hour ago. So yes, I am here to speak on the Birth Certificate Modernization Act. It is Senate Bill 314, the House version, which is being sponsored by a Delegate Ashanti Martinez, is not out yet. It should be, we should have the number momentarily by the end of the week. It's been submitted and it's just in the queue. The Senate version, I should mention, is sponsored by Senator Lamb. And the hearing in Senate Finance was this afternoon. So if I'm a little flustered, that's why. So the Birth Certificate Modernization Act does three key things. The first is that it eases the process and standardizes the process for transgender individuals to update their own information on their children's birth certificates. So if you're a trans parent, like I am, and you have a child, and that child was born prior to you transitioning, that birth certificate likely has your former legal name on it. And depending on when it was issued, it might say mother or father when you're now using different terms. Since 2021, the Division of Vital Records has actually been using parent, like parent 1, parent 2 on all birth certificates. So any new birth certificates issues will say that. So we're trying to standardize the process whereby you can change your own information. So I could update my name on my child's birth certificate, for instance. My child happened to be born in New York City rather than Maryland, so it doesn't directly affect me, but it does affect many Marylanders who've tried to go to the Department of Health and update their kids' birth certificates and told there's not a process for this. And frequently they're told either there's no process for this, so you have to leave. You can't do this, or there's no process for this, so I guess we can issue an amended birth certificate where we cross off your name and write, the new name. But that will often create like a weird document that outs you as trans and outs your kids as having trans parents. So we're standardizing the process that you can just go in with your court order name change and say, hey, I want to update my kid's birth certificate. And they'll be like, great, here it is. And so that's the first thing. The second thing will eliminate the requirement for medical sign-off to change your own gender marker on your own birth certificate. So if you were born in Maryland and you want to change the sex marker on your birth certificate, you currently have to either have a court order or a form signed by a medical provider that says, yes, this person has gone through treatment for gender dysphoria, et cetera. Now, what we found is that for low income folks, especially, they're like the requirement to get this paperwork signed by your doctor adds a significant unnecessary expense. People are having to make specific appointments just to get that done. Depending on the office, sometimes you'll have to go back multiple times to get them to do it right because they often make mistakes. My own provider sent me to their legal department, who then sent me back to the provider, who then it was a nightmare. We just want to eliminate that process and make it so that you can make your own statement as to what your sex is under penalty of perjury, and then the Division of Vital Records will issue you a new birth certificate with that designation. Now, that penalty of perjury is in there to eliminate any concern that legislators or others would have that someone might be doing this for a fraudulent purpose. So it has to be your actual internally felt gender identity. It can't just be something that you're doing for the purpose of making something up or perpetrating a fraud. And then the last thing which I do see Nadia talking about X markers in the chat, is it clarifies that X markers are available on Maryland birth certificates. Currently, Maryland uses X markers for driver's licenses, and this clarifies that the Department of Health can also use them for birth certificates.
Thank
Um,
you so much, Charlotte.
Now, I do see, I'm just going to address Nadia's question, if that makes sense.
I think you just answered her questions.
Okay.
It looks like there's another one that someone asked. Perhaps I don't fully understand this proposed legislation, but please explain how this is an women and family issue versus a gender identity issue.
Yes. So the key is that when we're talking about updating our kids' birth certificates, it's often, like that is inherently a family issue. Like having documentation that connects us to our kids is like inherently an issue of like how we, relate with them in the world. Like we have to often present that documentation when we're applying for health insurance or, enrolling our kids in schools, etc. It's also, really crucial to, remember that, there's a lot of trans women who are interested in this. There's a lot of trans men who are interested in this. And there's a lot of people who are married to like trans men and trans women and non-binary folk who, um, want to make sure that their spouse's information is correct and that their spouse isn't outed when they, enroll their kid in school. So it's definitely a women's issue. It's a family issue. I know that it's not something that has always been seen as in the arena of like women's issues, but in our it's 2025 and we are trying to build a intersectional coalition here.
So I did want to call out that there is a second part to Nadia's question from earlier. It said, how now that the X cannot be designated on new U.S. passports, how will this affect those who currently hold passports and need to renew them? Do you
Yeah.
have an answer for that, Charlotte?
I do have an answer for that. It's not within this bill because that's a federal issue, but I do have the answer for that. So any passport that's currently valid is still valid. The federal government has not rescinded any passports that where people have changed their gender markers or used X markers. Um, when it comes time to renew those passports, depending on what the gender marker is and what supporting documentation people have, you may or may not get the same gender marker on the next passport. Now, for people who have not previously had a passport and need to apply for one for the first time, if all of your documentation like has been updated and shows, you're a gender marker that's consistent with your gender identity, then the Department of State doesn't have any way of knowing that you're trans, and they'll issue you that passport with your correct gender marker. If though you have like a birth certificate from a state that does not allow you to change your gender marker. I was born in Indiana, for instance, and they make the process hard. Then likely the current thing that the Department of State would do is say, oh, well, we're requiring you to use your former gender marker. But it's a little up in the air and it's all subject to litigation. And so what I'm telling you right now is literally what the State Department is doing at this precise moment in time. And it might change and litigation might change it further.
Thank you so much, Charlotte. And I'd like to thank all of the presenters who took time from their day to present on all of the House and Senate bills. We are going to be moving on to Kate, who will be introducing our legislators.
Are there any legislators out there that have joined us? Well, I would like to say that it's been very enlightening, and thank you to the speakers who were very eloquent and concise about their presentations. And if there are no legislators out there, please, I will pass it on to Michael.
Okay, thanks, Kate. Well, I want to thank you all for attending MLAW's 2025 legislative briefing. Now go out and take action.